Hi, I am Girish Krishnani, and you are watching 5-Minute Learnings. Welcome to the third video in the series on personality disorders. Today we shall explore the schizoid personality disorder in detail. Schizoid personality disorder, SPD, is a chronic condition marked by social isolation and indifference toward others. People with SPD are often seen as distant or withdrawn. They avoid social interactions, have limited emotional expression, and lack interest in close relationships. SPD is relatively rare and affects more men than women. Those affected are also at higher risk for depression. People with SPD typically have few friendships, rarely date, and often don't marry. Jobs requiring social skills are difficult, making solitary work preferable. People with SPD typically experience preoccupation with fantasy or introspection, indifference to praise, criticism, or rejection, detachment from others, little desire for close relationships, indifference to social norms, rare participation in activities for fun, lack of enjoyment in social and family relationships, often described as cold, uninterested, or aloof. Symptoms often start in childhood and are clear by early adulthood, impacting family, school, and work. SPD versus schizophrenia. Although SPD shares some features with schizophrenia and schizotypal personality disorder, key differences exist. People with SPD rarely have paranoia or hallucinations. While conversationally aloof, their speech remains coherent. The causes of schizoid personality disorder are not known, although it is believed that a combination of genetic and environmental factors play a role. Personality is shaped by a wide variety of factors including inherited traits and tendencies, childhood experiences, parenting, education, and social interactions. All of these factors may play some part in contributing to the development of SPD. According to DSM-5, one must display at least 4 of the following symptoms in order to be diagnosed with SPD. Always chooses solitary activities, emotional detachment and lack of emotional expression, experiences little pleasure from activities, indifference to criticism or praise, lack of desire or enjoyment for close personal relationships, little or no interest in sex with other people, no close friends other than immediate family. Schizoid personality disorder is most often diagnosed by a psychiatrist or another mental health professional who is trained to diagnose and treat personality disorders. People who have schizoid personality disorder rarely seek out treatment on their own. It is often only after the condition has severely interrupted multiple areas of a person's life that treatment is sought. Moreover, they struggle with therapy due to difficulty forming relationship with therapist. Medication can help with symptoms like anxiety or depression, often combined with CBT or group therapy. CBT teaches coping skills, while group therapy helps practice social skills. Therapists must avoid excessive pressure. While isolation feels easier, loneliness occurs. Social groups focused on work or hobbies can help, as they require less emotional intimacy. Loved ones should be patient, non-judgmental, and encourage treatment. Avoid pressuring them into uncomfortable activities. Instead, find low-pressure shared activities. SPD is usually lifelong, but with support and treatment, people can lead functional lives. That's all for today on schizoid personality disorder. In the next video we shall take up schizotypal personality disorder in detail. Hope you found this video helpful. If you liked it, please give me a thumbs up, and follow or subscribe to my channel 5-Minute Learnings, and do remember to hit the bell icon to get notified on new content. Thanks for watching.